On this occasion, we're looking at healthcare and the training of practitioners in healthcare. And Jihad, I want to find out why Hill-Rom are investing so much into education of practitioners.
Because we believe in education and the fact that until today we don't have a lot of references in the region here. Most of the literature you look at are referenced to the US and to Europe, and the idea is to have references locally based here in the region, in Middle East and in Africa as well.
So the Middle East and Africa is the area where you are focusing from your base here in Dubai. So with your series of programs, tell us about that.
What we started a year ago when we moved to Dubai Healthcare City. This is where we invested in what we call it a customer education center, customer experience center, and we're running today every other month a booster program where we focus on our clinical awareness, focusing on areas like safe skin, clear lungs, early mobilization of patients, safe patient handling, and today the focus is on maternal care.
And where we are at the moment, we're surrounded by a multitude of different types of hospital beds. So is this a key area for Hill-Rom?
It is one of the key areas, but what we're trying to do going forward is Hill-Rom is investing in more of a total room solution. So it's not only the bed, but the mattress, the therapy mattresses, and the aesthetic of the room by providing the nice furniture so that the patient can feel at home rather than feeling at a hospital, so the environment can heal faster, help heal faster the patient.
Now, regarding this investment you're putting into the education of healthcare practitioners, you're really sort of training the trainers. So when they come to a session like they have been doing so today, what is the format?
So the format is 45 minutes of education session of presentations, with a lot of questions and answers, then followed by almost the same amount of demonstrations and hands-on. And we believe a lot in the demonstration and hands-on because that's when the caregivers can feel the bed, can practice what they're doing and practice what they've learned inside.
So what will be a typical group of carers attending the program?
So we usually target a maximum of 20 caregivers because we want to focus a lot on hands-on. So the larger the group, then the harder it becomes to have hands-on. So a maximum of 20 healthcare practitioners, they can come together, and ideally from different hospitals, different regions as well, so they can share experiences, share best practices, and they can learn from each other. And then when they go back and then they start using the program, implementing it, they can also compare notes.
And leading these sessions, you're bringing expertise from around the globe. Give us some idea of who you are attracting.
So we're bringing key thought leaders of a particular topic. So today we're focusing on maternal care, and we invited Dr. Elaine Zwelling, who's a thought leader on maternal care, positioning, and how to apply all the features we have on our special beds so that it can help deliver babies faster and more secure.
I'm showing them ways that they can use this bed to help their patients during labor, to move, to change positions, to stay upright, and they're even having some fun because we're getting them in the bed. They're trying some of the positions themselves, and so it's a very interactive seminar.
I think it is good. I got a lot of information, a lot of knowledge how I can utilize a Hill-Rom bed for improving our service in the labor room. By knowledge means how we can change position, can help the patient.
I very much appreciate the fact that they do bring somebody in from America to come and speak to us today, because it's always good to get an international level of what the experience is, what is the processes, what is going on in other countries. So with all the expertise that's coming from that side, obviously these are things that you can implement with you as well.
Well, it's great to meet other people that are in a similar position to what I'm in. We all come from different areas of expertise, different countries that we've practiced in, and it's a way of basically reaching a common goal.
So Jihad, some very enthusiastic ladies there. So when it comes to them going back out into their hospitals, the places where they're practicing, how is the success of these workshops measured?
So first we focus on following up with them, making sure that they implement what they've learned here, to take it to their healthcare workers, because it's not easy to go ourselves there. But we go there, help them to implement these programs, and then measure where they were today versus where they will become tomorrow, and hopefully maybe create reference sites, publish white papers, publish clinical papers of what they've done and what they've implemented.
So Jihad, thanks very much for joining us, giving us an insight into how Hill-Rom are investing in the education of healthcare practitioners.
Thank you, Phil.